Hello everyone, in this video about craniosacral therapy and the autonomous nervous system in the aspect of this therapy. Very briefly, quickly, I will tell you this basic information about what is this autonomous nervous system. So first of all, this is this part of nervous system which is not controlled by us. So, for example, if you would like to change, for example, your heart rate, so it's obviously it's difficult. It's known as this system which works on its own, and we, as the owner of this body nervous system, we don't have too much control on this. However, we can have big impact on this through some methods, therapies, and techniques which we can provide for our body. So coming back to basic information about this autonomous nervous system, so we can divide this into sympathetic nervous system, which is this system which basically provides for our body fight or escape. So heart increases, heart rate increases, breathing increases, blood goes to your muscles. So basically you need to be able to act, so to fight or to escape. And then we have parasympathetic nervous system, which it's known as this relaxation part of our nervous system, which is this good, calm part needed for regeneration. And signs of this system is, for example, like the heart rate goes down. Your eyes are smaller, not as big like you would see a ghost, which is sympathetic part. And your stomach is more visible because digestive system is working, because you don't need to do too much, you can rest, and for example, your meal might be digested because you don't need to fight, you don't need to escape, you're just in relaxation. And this parasympathetic nervous system, there you have two branches. So this nervous branch which provides this relaxation, and also it's a second way which actually goes into frozen state. And this is something what is also not good. It's physiology, but sometimes it happens that due to some traumas, person is easily triggered by something, and just it's like this, just like an ice basically, and can't do nothing. So not like in sympathetic nervous system where you can fight or escape. No, the person who is like in this parasympathetic frozen state is just not able to do anything. So cannot shout, can't escape, can't move. It's just frozen. So we know that this is not good, and it's really very good. It's just very beneficial for our awareness to know in which nervous system we are mostly in our daily life. So, for example, in my case, I was mostly in sympathetic nervous system. So I was easily triggered this way that my heart rate easily went up, and I was like in this mode to fight or to escape. But in modern life, you can't easily escape when you, for example, would like to, so you need to fight, but no, you also cannot fight. So basically, what's about, you want to hide this sympathetic signs of this nervous system which is on. So basically, your heart rate is high, your breathing is high, but for example, you are among people who just triggered you because, for example, someone you just, for example, about to be asked, and you're waiting for this, and your nervous system just is in the sympathetic mode, and it's all the signs of fast breathing, deep breathing, and heart rate is very high, and you actually can't settle this. So this is obviously not good for your health and for your being. And we also know that this is not a normal situation when you often in sympathetic nervous system, and also it's not good when you're frozen, right? So in this parasympathetic nervous system, but in this other path, not in relaxation, but in this mode, yeah, when you just like this. You could try meditation, you could try walking barefoot on grass, you could listen to relaxing music, you could be around people who make you cool and you feel safe with them. But also you might go for therapy, like craniosacral therapy, and here is advertisement of the methods, because I just presume that not everyone knows about this and is aware that you can actually do something about this. Step by step, this first sympathetic, then parasympathetic, and then the social aspect of your nervous system is improved, and it gets into balance. I don't think that it makes sense to explain exactly what is done, but quickly, just so first part of this therapy looks like any other, but then you go to work with a parasympathetic nervous system, and you're lying and you are asked to put your hands on your abdominal area, in your stomach, and having good feelings toward your abdominal area. So sending your own love to this part, and then therapies work. So, for example, me in this case with this system. So by holding a specific part of your head. And then when it's all balanced, so cerebrospinal fluid and all this flow is reached, so we go to sympathetic nervous system, and then you ask to tense and so to make fists in your hands and tie up your feet and your hands, and you lying in this tension until naturally your hands, the tension is released from your hands and feet. And then we're going to social aspects, then therapies. So for example, me holds in specific way hands on your head. So fingers go on triangular nerve, so which is also connected with social aspect, because it provides this nerves for these muscles, which actually express your feeling, your emotions. So this is the social aspect. And during this procedure, you ask to think about someone who you love, or about a pet. So basically, you want to be, you must be in this relaxing phase. Yes, or for example, it might happen, for example, that you might fall asleep. So then therapist thinks about you in safe place, and in general a safe place, it's we associate this scene when you as a baby in the stomach of your mom, and this is what is imagined in this process. And then when the flow comes to normal, so then we're working with a part here in your brain, and we just want to reach balance. And when it's all balanced, we finish therapy, doing some other needed procedures to close the process. So I had a client who came to me with a pain in her shoulder blade after holidays. So she went to her family. She hasn't seen them for years, and she met her brother there. And there was a lot of stress between them. And this stress, actually, she said that she thinks that when we talk, that maybe actually it's connected, because nothing happened and out of blue she just had this pain, and it was after the stressful situation for her. So I knew that it's not just structure in itself, that it must be psychosomatic issue. And so first when we met, I did correction, and then 3 days later she came for this craniosacral to balance her autonomous nervous system. And she just texted me that she feels great and it's all good. So she just came for second adjustment, just to check what needs to be done after this first adjustment. But these all symptoms were gone after we put her nervous system into balance. So just this is message to you that it's also possible to work with these aspects which I mentioned in this video earlier. So thank you for watching.